Now let's discuss the 5 transporting points. Yin spring points, kidney 12, placing value. Location at the medial border of the foot in a depression at the anterior border of the navicular bone at the border of the red and white skin. How to find? Palpate from distal to proximal along the tarsal section of the medial aspect of the foot, past the shaft and the head of the first metatarsal bone. That is the spleen 4, and the medial cuneiform bone, finally reaching the prominent navicular bone. Locate kidney 2 anterior to the navicular bone at the inferior angle of the joint between the medial cuneiform bone and the navicular bone. Needling from the medial aspect of the foot, 0.5 to 1 June, vertically below the border of the bone. Use reducing needling techniques for empty heat. Use tonifying technique for kidney yang or Qi deficiency. For the action indication, clear empty heat. It regulates the lower border and the kidneys. It's the local point. Special features, yin spring point, far point, meeting point with the yin kiao mind. Okay. Kidney 2 is the main point to clear empty heat from the kidneys. It is very much used in such symptoms as red cheekbones, 5 palm heat, feeling of heat in the evening, mental restlessness, thirst without desire to drink, and dry throat and mouth at night. It can be combined with lung 10 to clear empty heat from the lungs, or with heart 6 to clear empty heat from the heart. Being the spring point, it is very dynamic point and more used in excess patterns. Being the beginning point of the yin stepping vessel, can be used to move qi and blood in this vessel. In this context, it is specially used for unilateral abdominal pain and abdominal masses. It clears empty heat and boosts blood. In dry throat, night sweating, feeling of heat in the evening, 5 palm heat, malar flush. It also invigorates the yin stepping vessel, like itching of genitals, infertility, irregular menstruation, difficult urination, unilateral abdominal pain, abdominal masses. Kidney 2 is the yin spring and fire point of the kidney channel. According to the classic of difficulties, yin spring points are indicated for heat in the body. And in the case of most yin spring points, the emphasis is on clearing excess heat and fire. The kidneys are unique, however, in that they do not suffer from excess patterns, since the kidneys store true yin and true yang, which can never be in a state of real excess. Kidney 2, therefore, is the principal kidney channel point to clear heat deriving from kidney yin deficiency. The kidneys are the root of the yin and yang of the body. Kidney yin has the functions of nourishing and moistening, as well as balancing and restraining the Ming-Men fire. When the kidney yin is deficient, its nourishing and moistening function will be impaired, and additionally, the Ming-Men fire may blaze out of control. The forte of kidney 2, as its name implies, is to clear this deficient heat rather than nourishing the kidney yin. It is indicated when such heat ascends along the kidney channel to the throat, giving rise to the throat painful obstruction, dry throat with insufficient saliva and inability to speak, floats to the exterior at night, giving rise to night sweating, and disrupts the lung, giving rise to dyspnea and coughing of blood. Heat from yin deficiency may also manifest as wasting and thirsting disorder and hot and restless feet. Kidney 2 has a particular action on the lower jaw. Deficiency of yin and consequent heat may give rise to genital itching. When kidney yin fails to nourish the conception and penetrating vessel, there may be irregular menstruation and infertility in women. When deficiency heat agitates the gate of essence event, there may be seminal emission or nocturnal emission, with or without dreams. In both men and women, there may also be excessive sexual desire. If the kidney qi is deficient, there may be uterine prolapse. According to the complete works of Jingye, yin and yang are of the same origin. Fire is the ruler of water. Water is the source of fire. Neither deficiency of kidney yin nor kidney yang exists in isolation, and this is reflected in the fact that kidney 2 also clearly has an action of tonifying kidney yang. This is partly illustrated by the traditional indications, but is reflected most clearly in a variety of classical combinations. Kidney 2, therefore, may also be treated by moxibustion in cases of spontaneous sweating, coldness in the feet and legs, cold diarrhea, edema, and impotence. Finally, the emotion associated with kidney is fear. And when the kidneys are deficient, there may be propensity to fear and fright and a constant feeling of alarm as though one were about to be apprehended. Kidney 2 is indicated for these various feelings of foreboding. Thank you for your attention.
Let's talk about pericardium 6, inner gate, a 5-command point. Pericardium 6 is located too soon proximal to the anterior wrist joint space, which is the most distal wrist crease between the tendons of the palmaris longus and flexor carpi radialis muscles. How to find pericardium 6? As the location of the wrist crease varies, the wrist joint space is a more reliable reference point. It can easily be palpated by moving the patient's hand in a relaxed way from the center of the wrist joint space, which is pericardium 7, measure tutsun in a proximal direction and locate pericardium 6 between the two tendons, which become more pronounced when the fingertips are pressed together. If only one tendon is visible, this will be the tendon of the flexor carpi radialis muscle. Pericardium 6 is located on its ulnar aspect, or using the quick method, from the center of the wrist joint space, glide in a proximal direction between the two tendons. The skin will begin to form a bulge in front of the sliding finger, which will come to a halt at pericardium 6. Triple burner 5, tutsun proximal to the dorsal wrist joint space, is located opposite pericardium 6. Needling is 0.5 to 1 sun vertically or obliquely in a proximal or lateral direction. Caution, the median nerve is located directly below this point. Actions or indications: calms the shen, unbinds the chest, harmonizes the stomach, opens the channel. Special features: PC6 is a luo connecting point. It is also the opening or master point of the yin wei mai, the hiccough command point for the thorax, the main point for nausea and vomiting, and it is a very important point. Pericardium 6 is one of the most important points of acupuncture, with a great number of different functions. It has a specific action on the chest and can therefore be used for any chest problems. More specifically, it moves qi and blood in the chest and is the point of choice for discomfort or pain of the chest due to stagnation of qi or blood. Pericardium 6 has a powerful calming action on the mind and can be used in anxiety caused by any of the heart patterns. It also calms the mind by its indirect action on the liver, to which the pericardium is related within the terminal yin or jue yin. It can therefore be used for irritability due to stagnation of liver qi, particularly if combined with anxiety from a heart pattern. It is particularly effective in women and is most useful to calm the mind in women suffering from premenstrual depression and irritability. It also promotes sleep. In addition to its action on the heart and liver, pericardium 6 is a major point to affect the stomach, particularly the upper and middle part of the stomach. It subdues rebellious stomach qi and is the point of choice to treat nausea and vomiting. It can also be used in most excess stomach patterns characterized by epigastric pain, acid regurgitation, hiccough, and belching. As it is the connecting point of the pericardium channel, it connects with the triple burner channel, and it is effective in treating neck ache on the occiput, especially in women. Women also often suffer from neck ache after a hysterectomy, and this point is very effective in treating it. The explanation of the acupuncture point says, when the pericardium is empty, there is stiffness of the head. Owing to its relationship with the liver and its action of invigorating blood, pericardium 6 is indirectly connected with the blood of the uterus and can be used to regulate irregular or painful periods. The pericardium influences the uterus also, due to the connection between the heart and uterus through the uterus vessel called palmari. So here you could see the relationship between pericardium, the heart, liver, and uterus. So the heart is connected to the uterus via the uterus vessel, and the pericardium being part of the terminal Dreyan channel will be very important in treating liver issues because the liver stores blood. So this somehow explains why pericardium 6 is very effective for heart and liver issues. So to summarize, pericardium 6 opens the chest and moves the qi and blood. So this is very good for chest pain, palpitations, feeling of tightness of the chest. PC6 calms the mind, so it's good for insomnia, those with manic behavior, poor memory, anxiety, fright, sadness, depression. It moves liver qi, so very effective for hypochondrial, distension, and pain. Harmonizes the stomach, nausea, vomiting, hiccough, belching, epigastric distension, and pain. Invigorates blood and regulates menstruation. Very effective for irregular periods and painful periods. The pericardium channel belongs to fire, and like many other points of the channel, pericardium 6 is indicated for a variety of manifestations of heat, including fevers, jaundice, red face with hot skin, painful urinary dysfunction, cracked and bleeding tongue. The Great Compendium of Acupuncture and Moxibustion gives specific indications for excess and deficiency of the luo connecting points. In the case of pericardium 6, these are sudden heart pain, which is an excess pattern, stiffness and pain of the head and neck, which is a deficiency pattern. Thank you very much for listening.
Let's continue our discussion on the extra points. Today we discuss about extra point VXHN8, upper Yushang or Bitong, and Jingchong, the middle of periods. So let's start with VXHN8, the upper Yushang or the Shang. It's located at the upper end of the nasolabial groove at the junction of the maxilla and the nasal cavity. We have to note here, Bitong, or the clear nose, is an alternative name for this point. So how do we find this point? It is at the upper end of the nasolabial groove. So palpate for the bony margin of the nasal cavity here. EXHN8 is located at the junction of the nose and the cheek. Needling this point is 0.3 to 0.5 tune vertically towards the center of the nasal cavity. For its actions and indications, it clears heat, opens the nasal passages. So, Bitong free nose passages. It is located on the side of the nose, halfway between the glabella and the tip of the nose. Its action, it opens the nose. Here is an illustration where we can find Bitong relative to the point Tianzhu and Yuyao. So again, Bitong is indicated for sneezing, allergic rhinitis, a congested nose, nasal discharge, sinusitis, blocked sinuses, and facial pain. This point is very useful to use for allergic rhinitis or sinusitis to open the nasal passages. It also opens the maxillary sinuses. This point is more effective than Li20 for such problems. Li20 is better at expelling wind from the face, hence in facial paralysis, while Bitong is better at opening the nasal and sinus passages. Some doctors locate this point slightly higher than what is described in other books, as was taught by teachers in Nanjing. The manual of acupuncture locates this point at the highest point of the nasal labial groove. Again, this point opens the nose for sneezing, allergic rhinitis, congested nose, nasal discharge, sinusitis, blocked sinuses, and facial pain. Bitong is a modern addition to the extra points and is commonly used for the treatment of nose disorders, especially by through needling from Li20. For point combinations, in case of chronic rhinitis, Bitong is combined with Li4, Lu23, and bladder 7. Next, we have point Jingchong, or middle of periods. It is located on the lower abdomen, shown from the midline, level with REN6. For its actions, it regulates the uterus and menstruation. For its indications, it's indicated for irregular periods and mid-cycle bleeding. This point is mostly used for irregular periods and mid-cycle bleeding. Again, it regulates the uterus and menstruation, indicated for irregular periods and mid-cycle bleeding. Thank you for your attention.
We continue with the back transporting points. Bladder 47, gate of the ethereal soul, Hunmen. Location, retune lateral to the posterior midline on the level of the lower border of the spinous process of the 9th thoracic vertebra, T9. How to find? In a sitting position with the arms hanging down, the spinous process of T7 is generally on the level of the inferior angle of the scapula. From there, count down 2 processes to the lower border of the spinous process of T9. Bladder 47 is located 3 tune lateral to this point, or locate the spinous process of C7. From there, count down 9 processes to the lower border of the spinous process of T9 and locate bladder 47 3 tune lateral to it. Located on the same level are Duke 8 on the midline, a point of EXB 2.5 tune lateral to the midline, and bladder 18 1.5 tune lateral to the midline. Needling obliquely 0.3 to 0.5 tune. Caution, pneumothorax. Action indication, bladder 47 spreads the liver chi, harmonizes the spleen and the stomach, relaxes the tendons. Bladder 47 is used for emotional problems related to the liver, such as depression, frustration, and resentment over a long period of time. This point settles and roots the ethereal soul in the liver. It strengthens the ethereal soul's capacity of planning, sense of aim in life, life dreams, and projects. It is a door, so this point regulates the coming and going of the ethereal soul and mind. That is the relationship with other people and the world in general. It has an outward movement which could be compared and contrasted with the inward movement of bladder 42. The explanation of acupuncture points confirms that due to this point's nature of window, gate, or door, the arterial zone goes in and out through it. This confirms the dynamic nature of this point in stimulating the movement of the arterial zone and mind. However, it can also work in the other way, that is, to calm down the excessive movement of the arterial zone. When used in conjunction with bladder 18, it has a profound influence on a person's capacity of planning his or her life by routing and steadying the arterial zone. It can help a person find a sense of direction and purpose in life. This point will also help to lift mental depression associated with such difficulties. Because it roots the arterial zone, it can be used for a big feeling of fear occurring at night in persons suffering from severe deficiency of BL. When used to calm down the excessive movement of the arterial zone, this point can be used for slightly manic behavior and mental confusion. On a physical level, this point is very useful in treating stagnant liver chi, insulting the lungs, as it happens in some types of asthma. It regulates the liver chi and benefits the sinews for costal pain, hypochondrial pain, fullness of the chest, contracture of the sinews. Roots the arterial zone, those with fear, depression, insomnia, excessive dreaming, lack of sense of direction in life, possession by herpes. This point can regulate the coming and going of the arterial zone and help a person develop a sense of direction and purpose in life. Bladder 47 is level with the bladder 18, the back-shoe point of the liver. The liver stores the arterial zone, the whole, but despite its striking name, gate of the arterial zone, psychological and emotional indication for this point are notably their absence in major classical texts. Bladder 47 does, however, have some action on regulating the liver chi and soothing the sinews and is indicated for fullness and distension of the chest, lateral costal region, contraction of the sinews and bone, and joint pain of the whole body. It is also able to regulate the middle jaw, creating disharmony of both the spleen, those with diarrhea, borborygmus, and the stomach, difficult ingestion, and vomiting. According to the essential question, the 5 outer bladder points level with the 5 sang back-shoe points, that is the bladder 42, bladder 44, bladder 47, bladder 49, and bladder 52, drain heat from the 5 sang, an action shared by the back-shoe points of the 5 sang. Thank you for your attention.
Let's now talk about the stomach channel, the primary channel. The stomach channel starts from the lateral side of the Alanasi at Li20. It ascends along the nose and meets the bladder channel at bladder 1. It then enters the upper gums. It curves around the lips and links with the directing vessel at REN24. It then runs along the lower jaw and ascends in front of the ear to reach the forehead. From stomach 5, a branch goes down to the throat and the supraclavicular fossa. It then passes through the diaphragm, enters the stomach and the spleen. From the supraclavicular fossa, a branch follows the superficial channel down to the breast and abdomen to pass through stomach 30. Another branch from the stomach connects with the point stomach 30. From this point, it follows the superficial channel to run along the anterior aspect of the upper leg and the anterior border of the tibia to end at the second toe. A branch from stomach 42 links with the spleen channel. Overview of stomach points. Affect leg, abdomen, chest, throat, and face. Treat the limbs and painful obstruction syndrome. Treat all abdominal symptoms. Strengthen chi and blood and resistance to pathogenic factors. Resolve phlegm. treat problems of the face and sinuses. So let us now review or discuss in more detail the very complex pathway of the stomach. The stomach primary channel begins with an internal branch at the yang axis connection of the first great circuit, Yang-Ming hand-foot pairing at Li20, lateral to the Alanaceae, then travels internally to bladder 1 at the inner canthus of the eye, emerges at the infraorbital ridge at stomach 1, the beginning of the external part of the primary channel. Then it descends laterally along the nose and enters the gums of the upper jaw. Meets the contralateral stomach primary channel and the tumai at 226 and emerges again. Curves around the lips to meet the renmai and again the contralateral stomach channel at Ren 24. Traverses the lower cheek and winds around the lower angle of the mandible. Here at stomach 5, the external channel divides into 2 branches. One branch ascends anterior to the ear, travels via gallbladder 3, gallbladder 6, gallbladder 5, and gallbladder 4 to the temporal region, to stomach 8, and continues to the forehead to meet Du24, where it terminates. The other external branch descends along the lateral aspect of the neck to the supraclavicular fossa and travels posteriorly over the back of the neck to Du14, below the spinous process of the 7th cervical vertebra, where it meets the other 5 yang primary channels. An internal branch descends from the supraclavicular fossa, passes the diaphragm, enters first its pertaining fu organ, the stomach way, and then connects with its paired zang organ, the spleen. Minor branches of the internal channel intersect with Ren 13, Ren 12, and Ren 10. The internal branch then descends towards the inguinal region, where it emerges slightly superior to stomach 30 and reconnects with the external branch. The external channel descends from the supraclavicular fossa, crosses the nipple, and laterally passes the umbilicus, travels in a curve to the leg and knee, continues along the anterior crest of the tibia and dorsum of the foot, and terminates on the second toe at stomach 45 at the lateral corner of the nail. An internal branch originates below the knee area at stomach 36 and travels to the lateral aspect of the middle toe. A further branch separates from the primary channel at stomach 42 on the dorsum of the foot and connects at spleen 1 with its paired spleen channel on the medial aspect of the big toe. This is the foot yin-yang connection of the first great circuit. Clinical importance. Exterior Piao signs and symptoms: high fever, malaria, flushed face, sweating, confused mental state, dry lips and mouth, lesions of the lips and mouth, sore and swollen throat, thoracic pain, red and swollen legs. Interior or Zangfu organ signs and symptoms. We have abdominal distension, sensation of fullness, edema, irritability during work and rest, mania and epilepsy, hyperpepsinia, constant hunger, yellow urine. Excess will have heat sensations on the anterior aspect of the body, constant hunger, and yellow urine. And then for deficiency symptoms, we have cold sensations on the anterior aspect of the body, chills, stomach cold with distension and fullness. Connections and meeting points of the stomach primary channel. So with the spleen primary channel, connection is foot yin-yang connection of the first great circuit. Location, stomach 42 to spleen 1 on the foot. Circulation, circadian, according to the organ clock. Importance, exterior-interior relationship. With the large intestine primary channel, connection is paired according to the 6-channel theory, the hand-foot pairing, Yang-Ming, yang axis of the first great circuit. Location, Li20 to bladder 1 to stomach 1 on the head. Circulation is circadian according to the organ clock. Importance, above-below relationship. Connections with other Zangfu organs, stomach and spleen. Thank you for your attention.
Let's continue with location methods and tune measurements. Today we discuss about shoulder and upper arm. Let's start with the trapezius muscle. Here we have illustrations showing the trapezius muscle, the acupuncture points near it, and the other muscles such as the deltoid muscle and other bones, or particularly the scapular spine and the acromion. So first, where is this trapezius muscle? This muscle covers the superior aspect of the shoulder or the shoulders. Its superior portion extending from the cervical spine to the acromion at the lateral end of the scapula. Located at the midpoint of the superior border of the muscle are points gallbladder 21 and slightly inferior triple burner 15. Next, we have the acromion. So when palpating the shoulder joint from a lateral direction, the acromion can be felt as a bony extension with a flat surface slightly superior to the laterally protruding head of the humerus. Here we also have an illustration showing where the acromion relative to the deltoid, the trapezius muscle, the scapular spine, and the humerus and other muscles and bones near the trapezius muscle. Okay. Next, we have the scapular spine. The scapular spine forms a bony ridge that originates at the acromion and runs in an oblique angle across the scapula, ending at its medial border in an upward opening curve. This is the location of SI13 and Li16, which is located on the most lateral portion of the trapezius and the supraspinatus muscle, in the angle between the acromion or acromial origin of the scapular spine and the acromioclavicular joint. Next, we have the head of the humerus and the shoulder hollows. The head of the humerus is located inferior to the acromion and protrudes slightly on the lateral aspect of the shoulder. When abducting the arm horizontally, 2 hollows will form at the transition from the arm to the shoulder. The anterior hollow is the location of Li15, while triple burner 14 is located on the posterior one. The hollows mark the border between the clavicular and acromial portion and the border between the acromial and the spinal portion of the deltoid muscle. Next, we have the deltoid muscle. This muscle covers the anterior, posterior, and lateral aspect of the head of the humerus. The following points are located either on the muscle or on its margins. These points are SI9, SI10, triple burner 14, Li15, the extra point UE, lung 1, lung 2, lung 3, and Li14. Thank you for your attention.
We continue with the window of heaven points, bladder 10, heavenly pillar. Location, approximately 1.3 tune lateral to U15, where the trapezius muscle inserts on the lower border of the occiput, close to where the major occipital nerve emerges. How to find? With the patient's head in an upright and relaxed position, first locate GB20 below the lower border of the occiput and between the insertions of the sternocleidomastoid and trapezius muscles. From there, palpate in the medial and inferior direction at an angle at a 45 degrees angle until the finger comes to a halt against the bulge of the trapezius muscle. This is the location of bladder 10. For reference, if the practitioner places their left middle finger on GB20, the shorter index finger will pointing to bladder 10. Located on the same level is DU15, approximately 1.3 tune lateral to the midline and superior to the axis. First, palpable spinous process. Needling, 0.5 to 1 tune vertically or slightly oblique in a dorsal direction. Caution, do not needle in a superior direction. Action indication regulates the qi, calms wind, and the shen benefits the head and sensory orifices. Opens the channel, strengthens the lower back, expels wind. Special features, window of the heaven point, important point for expelling internal and external wind. In contrast to GB20, bladder 10 is used in clinical practice mainly for pacifying internal wind. Small intestine and bladder pertains to greater yang, which opens on the exterior. Of the three yang, the greater yang channel are the most yang or most exterior. In addition, the area on the top of the body, like the occiput, is even more yang in relation, for example, to the inferior part of the bladder channel. This was two main implications. On the one hand, it means that the points in this area are yang in nature and can therefore be used either to tonify the yang, inability to support the body, or to expel yang pathogenic factors such as wind, epilepsy, or stiff neck. On the other hand, beginning yang and being at the top of the body, this area suffers from rebellious qi flowing out, and points in this area can be used to subdue rebellious qi, those having dizziness and headache. Being yang in nature due to its channel polarity and position, bladder 10 treats excess of yang causing mental problems, incessant talking, seeing ghosts, manic behavior. Being situated on the hinge of the occiput and being like a gate of yang qi, bladder 10 is reestablishes the balance in the flow of yang to and from the head, and can be used when there is excess yang above and deficient yang below. Soft legs, weak legs that cannot sustain the body. Bladder 10 is an important point to expel both interior and exterior wind from the head, and is a major local point for occipital or vertical headache from any origin. It can be used to expel exterior wind in the case of stiff neck and headache deriving from invasion of Bitong. Can extinguish interior wind and is used in this way mostly for occipital headache deriving from liver wind rising. However, it can be used for virtually any type of occipital headache. As bladder 10 is situated at the point where the bladder channel and the eye system emerge from the brain, this point can be used to clear the brain and stimulate memory and concentration. It has a special effect on the eyes and is used to increase vision, especially if the eyesight is diminished from kidney deficiency. Finally, it can be used as a distal point for bilateral acute lower back ache. This point is usually needled first with reducing method, while the patient in a standing position gently bends forward and backwards. After a few minutes of this, the patient is made to lie down, and local points are used on the lower back. As a window of heaven point, bladder 10 regulates the ascending and descending of qi to and from the head and subdues rebellious qi. This is another reason why this is a major point for the treatment of headaches from liver yang rising and mental emotional problems. It extinguishes wind and subdues liver yang in dizziness, muscle cramps, stiffness of the neck with inability to turn the head, headache, feeling of heaviness of the head, epilepsy. It also expels exterior wind in aversion to cold, fever, body aches, It also strengthens the greater yang channels in inability of the legs to support the body, soft legs, weak legs that cannot sustain the body. It also clears the brain in mental confusion, difficulty in concentrating, and poor memory. Opens the sense orifices, eye pain, red eyes, blurred vision, lacrimation, difficulty in speaking, nasal congestion, loss of sense of smell. It also removes obstruction from the channel in pain in the body, pain in the shoulder and back, and opens the mind's orifices in manic behavior, incessant talking, seeing ghosts. In common with the other window of heaven points, ladder 10 is indicated when inversion chi, chaotic, and rebellious chi rises to the head. This may give rise to dizziness, headache, heaviness of the head, stiff neck, and epilepsy, as well as congestion, pain, and swelling of the throat, eyes, and nose, while at the same time the lower part of the legs are unable to support the body due to unbalanced distribution of chi. The use of ladder 10 for disorders such as inability of the legs to support the body, pain of the body, and headache accompanied by lumbar pain is a reflection of the principle of selecting points above to treat disorders below. Like lung 3 and SI16 also points of the window of heaven. Ladder 10 is further indicated for mental disorders characterized by mania and incessant talking, as well as for disorders characterized in classical texts as seeing or communicating with ghosts, and therefore attributed to some form of demonic possession. In terms of modern medicine, this indication refers to various forms of severe mental disorder, including schizophrenia. Finally, there is some similarity between the indication of ladder 10 and GB20, with points being located close to each other. GB20, however, is much used clinically both to expel exterior pathogenic wind and to pacify interior wind, while the clinical use of ladder 10 is primarily confined to pacify the interior wind. Thank you for your attention.
Still on common cold and influenza, we discussed the pattern stomach heat and stomach and intestines dry heat. Clinical manifestations of stomach heat: high fever, intense thirst, feeling of heat, restlessness, profuse sweating, and coarse breathing. Tongue is red with dry yellow coating, pulse overflowing or big. This is the classic pattern of stomach heat at the chi level and is identical with the bright yang channel pattern of the 6 stages. It is often summarized as the 4 Bs, that is, high fever, intense thirst, profuse sweating, and big pulse. As a stage following an exterior invasion of wind, it is more common in children than adults. Treatment principle: clear stomach heat, prevent injury of yin. Points: stomach 44, Li11, do 14 using reducing method. Stomach 44 clears stomach heat. Li11 and do 14 clear heat. Now let's talk about stomach and intestines dry heat. Clinical manifestations: high fever that is worse in the afternoon, constipation, dry stools, a burning feeling in the anus, abdominal pain and fullness that is worse with pressure, restlessness, thirst, a faint feeling, and delirium. Tongue is red with a very dry, thick yellow, brown, or black coating. Pulse, deep, full, and rapid. This is the classic pattern of stomach fire as opposed to stomach heat of the previous pattern. Fire lies deeper within the body and dries up fluids in the intestines. Hence, the constipation and abdominal pain and fullness. Stomach fire is treated by purging. As a stage following an exterior invasion of wind, it is more common in children than in adults. Treatment principle: drain stomach fire by purging benefit fluids. Points: LI11, stomach 25, spleen 15, stomach 44, stomach 45, bladder 25, triple burner 8, and kidney 6, all using reducing method. LI11 clears stomach and intestines heat. Stomach 25 and spleen 15 regulate intestines, clear stomach heat, and promote bowel movement. Stomach 44 and stomach 45 clear stomach heat. Stomach 45 is particularly indicated if there is mental restlessness. Bladder 25 drains stomach fire by promoting the bowel movement. Triple burner 8 and kidney 6 promote the bowel movement in heat diseases. Thank you for your attention.